Hey everyone, welcome back. Today we're doing a deep dive into something pretty important, and yeah, something a lot of folks are talking about. It's about those potential Medicaid cuts you've been seeing in the news. We're going to try to figure out what's really going on here.
Yeah, for sure.
We're going to be looking at an article called "Trump's Medicaid Freeze Puts 72 Million Americans at Risk." And let me tell you, this situation is a lot more complicated and frankly a lot more worrisome than a lot of people think.
Absolutely. You hit the nail on the head. It goes way beyond just numbers on a page.
Right.
We're talking about 72 million Americans, people who depend on Medicaid.
Yeah.
I mean, we're talking about single mothers, children, people with disabilities, people who need Medicaid to get basic health care. And if they lose that, they could lose access to, medications, treatments, preventative care, the stuff that keeps them healthy.
Yeah. And the article really does not paint a very rosy picture.
Right.
It says the entire Medicaid payment system is frozen
Wow.
across all 50 states. So that means hospitals and doctors aren't getting paid for treating Medicaid patients.
Oh, wow.
Can you walk us through how a funding freeze like this, how this actually affects our healthcare system?
Yeah, I mean, try to picture yourself as a doctor. Let's say you're running a small practice. Every day you're treating patients, and a lot of them depend on Medicaid, right?
Right.
And suddenly those payments just stop, gone.
Yeah.
You still got to pay your staff, you got rent, medical supplies. All these costs keep piling up, but the money's just not coming in. It's a real struggle to even keep the lights on. And a lot of these healthcare providers, they're forced to make some really tough choices that could affect how they care for their patients.
It's a scary thought. So how did we even get to this point?
Well, yeah, it's a good question.
The article explains that this freeze is tied to, well, is connected to President Trump's executive orders to cut funding for programs he considers, unnecessary.
That's right, yeah. These executive orders, they're targeting programs that have to do with things like diversity, gender policies, climate change. And it seems like this Medicaid freeze, it's kind of like an accidental side effect of these broader budget cuts,
An unintended consequence.
Exactly.
Yeah. And, the impact of this is nationwide.
Huge.
Senator Chris Murphy is quoted in the article, and he says, hospitals and doctors can't get paid. So it's obviously a pretty urgent situation.
Definitely. And what's interesting is that this issue, it's not really falling along the usual party lines.
Really?
Even Senator Ron Wyden, who, he often disagrees with President Trump.
Of course.
He's confirmed how serious this is. He said that Medicaid portals are down nationwide.
Wow.
And these portals, that's how healthcare providers submit their claims. That's how they get paid. So when they shut down, the whole payment system basically grinds to a halt.
Yeah, that's a huge problem. Now, the White House is saying that, this is just temporary. They're saying it's a glitch and that the payments are being processed. Do you buy that? Do you think there's something more to this?
I mean, that's the big question, right?
Yeah.
On the surface, it could look like just a technical problem. But when you look at the timing and you see this push for budget cuts, well, it raises some red flags.
For sure.
So is it a hiccup? Or is this a sign of deeper cuts? Like, are they coming for public health care? It's definitely something we need to watch very closely.
Absolutely. Especially with that February 10th deadline coming up.
Yeah.
The one where federal agencies